Welcome to the official Global RPH YouTube channel. We're so glad you're here. If you haven't already, hit that subscribe button to stay updated with our latest videos. Our passionate team is dedicated to bringing you engaging, informative, and easy-to-digest content. Whether you're looking for medical insights, the latest healthcare trends, or fun educational content, there's something here for you. So stick around, be part of our growing community, and get ready for new and exciting content coming your way. This video analyzes the recent developments in targeted therapy and immunotherapy for cancer treatment, focusing on advancements made since 2022. It compares these two approaches by examining their mechanisms, effectiveness, and potential applications across various cancer types. By examining recent clinical trials and research findings, we aim to provide a detailed overview of the current state of these therapies in oncology. Additionally, it discusses the challenges and limitations of each approach, as well as potential future directions in cancer treatment. Introduction. Cancer remains a major global health concern, with researchers continuously seeking more effective and less toxic treatment options. In recent years, targeted therapy and immunotherapy have emerged as promising alternatives to traditional chemotherapy and radiation. This video reviews the most recent developments in these approaches, comparing their benefits, potential side effects, and applications across different types of cancer. Targeted therapy recent advancements. Targeted therapy in oncology involves the use of drugs or other substances that specifically target cancer cells while minimizing damage to healthy cells. Since 2022, several notable advancements have been made in this field. 1. Precision medicine and biomarker-driven therapies. Recent studies have focused on developing more precise targeted therapies based on specific genetic mutations or biomarkers. For example, a 2023 study published in the New England Journal of Medicine reported on a new targeted therapy for KRAS G12C mutated non-small cell lung cancer, showing improved progression-free survival compared to standard chemotherapy. 2. Combination therapies. Combining targeted therapies with other treatment approaches has shown promise in enhancing effectiveness. A 2022 clinical trial published in the Journal of Clinical Oncology demonstrated that a combination of a BRAF inhibitor, an MEK inhibitor, and an EGFR inhibitor led to better outcomes for patients with BRAF V600E mutant colorectal cancer. 3. Novel drug delivery systems. Advancements in nanotechnology have led to the development of new drug delivery systems for targeted therapies. A 2023 study in Nature Nanotechnology described a nanoparticle-based delivery system that improved the efficacy of targeted therapy in HER2-positive breast cancer models. Immunotherapy recent developments. Immunotherapy works by stimulating the body's immune system to recognize and attack cancer cells. Since 2022, several important developments have occurred in this field. 1. CAR T-cell therapy modifications. Chimeric antigen receptor or CAR T-cell therapy has shown promising results in treating various blood cancers. A 2023 study in the Lancet Oncology reported on a new CAR T-cell therapy targeting multiple myeloma, demonstrating improved response rates and durability compared to previous treatments. 2. Checkpoint inhibitor combinations. Researchers continue to explore ways to improve the effectiveness of immunotherapy, particularly by combining different checkpoint inhibitors. A 2022 study published in the Journal of Clinical Oncology found that using PD-1 and CTLA-4 inhibitors together led to better overall survival in patients with advanced melanoma compared to using a single agent alone. This approach aims to strengthen the immune system's ability to recognize and attack cancer cells more effectively. 3. Personalized cancer vaccines. Advancements in genomic sequencing and bioinformatics have led to the development of personalized cancer vaccines. A 2023 Phase 2 clinical trial published in Nature Medicine demonstrated the potential of mRNA-based personalized cancer vaccines in combination with checkpoint inhibitors for treating advanced melanoma. Comparison of targeted therapy and immunotherapy. Effectiveness. Both targeted therapy and immunotherapy have shown considerable improvements in patient outcomes compared to traditional chemotherapy. However, their effectiveness varies depending on the cancer type and individual patient characteristics. Targeted therapy has demonstrated high response rates in cancers with specific genetic mutations such as EGFR-mutated non-small cell lung cancer or HER2-positive breast cancer. A 2023 meta-analysis published in JAMA Oncology found that targeted therapies improved progression-free survival by an average of 6 to 8 months compared to standard chemotherapy across various cancer types. Immunotherapy, particularly checkpoint inhibitors, has shown durable responses in a subset of patients across multiple cancer types. A 2022 review in Nature Reviews Clinical Oncology reported that some patients with advanced melanoma or non-small cell lung cancer treated with immunotherapy experienced long-term survival benefits extending beyond 5 years. Side effects. While targeted therapies generally cause fewer side effects than traditional chemotherapy, they can still lead to skin rashes, diarrhea, and liver issues depending on the specific drug. Immunotherapy, by contrast, can trigger an overactive immune response, sometimes affecting multiple organs. Common side effects include fatigue, skin rashes, and endocrine disorders. In rare cases, severe autoimmune reactions may occur, requiring close monitoring. A 2023 study in the Journal of Clinical Oncology compared the safety profiles of these two treatment types, finding that while both had fewer severe side effects than chemotherapy, immunotherapy carried a higher risk of long-term autoimmune complications. Cancer types and patient selection. Targeted therapy works best in cancers with well-defined genetic mutations or molecular targets, such as certain types of lung cancer, breast cancer, and leukemia. Genetic testing is typically required to determine if a patient is a good candidate for targeted therapy. Immunotherapy, meanwhile, has shown success across a broader range of cancers, including melanoma, lung cancer, bladder cancer, and kidney cancer. However, not all patients respond equally well to immunotherapy, and researchers are still working to identify reliable biomarkers that predict treatment success. A 2023 review in Nature Reviews Cancer examined factors influencing patient response to these therapies. The study emphasized the role of tumor mutational burden, microsatellite instability, and PD-L1 expression in predicting immunotherapy success, while highlighting how specific genetic mutations determine targeted therapy outcomes. Challenges and future directions in cancer treatment. Cancer treatment has made significant progress with innovations like targeted therapy and immunotherapy. However, these approaches come with challenges that limit their effectiveness for some patients. Researchers are actively working on strategies to overcome these obstacles and enhance treatment outcomes. Challenges in targeted therapy. Targeted therapies are designed to attack specific molecular features of cancer cells while sparing healthy tissue. Although they have revolutionized treatment for certain cancers, they are not without limitations. Drug resistance. One of the biggest challenges with targeted therapy is that cancer cells can evolve over time, developing resistance to the drugs. This can occur through genetic mutations or alternative signaling pathways that allow the cancer to continue growing despite treatment. As a result, many patients experience initial success with targeted therapy only to see their cancer return or progress later. Limited applicability. Not all cancers have well-defined molecular targets that can be addressed with available drugs. This means that targeted therapy is only an option for patients whose tumors have specific genetic or protein markers. For cancers without such markers, other treatment approaches must be used. High costs and accessibility issues. Targeted therapies can be expensive, often costing thousands of dollars per month. This financial burden can make it difficult for many patients to access these treatments, especially in countries or regions with limited healthcare coverage. Challenges in immunotherapy. Immunotherapy works by boosting the body's immune system to recognize and attack cancer cells. While this approach has led to groundbreaking successes, it does not work for everyone, and some patients experience severe side effects. Unpredictable response. Unlike traditional treatments like chemotherapy, which have more consistent effects, immunotherapy has highly variable response rates. Some patients experience long-lasting remission, while others do not respond at all. Scientists are still working to understand why some individuals benefit while others do not. Immune-related side effects. Because immunotherapy stimulates the immune system, it can sometimes lead to unintended attacks on healthy tissues, causing autoimmune reactions. These side effects can range from mild inflammation to severe complications affecting organs such as the lungs, liver, or heart. Managing these side effects requires close medical supervision. Delayed effectiveness. Unlike targeted therapies, which can shrink tumors rapidly, immunotherapy often takes weeks or even months before noticeable effects appear. This delay can be challenging for patients with aggressive cancers that require immediate control. Future directions in cancer treatment. To improve outcomes and make cancer therapies more effective for a broader range of patients, researchers are exploring innovative strategies. Combination therapies. One promising approach is combining targeted therapy with immunotherapy. By addressing cancer through multiple mechanisms, these combination treatments aim to reduce resistance and improve response rates. Some clinical trials are already showing encouraging results. Advancing biomarker research. Scientists are working on identifying more reliable biomarkers that can predict which patients will benefit from targeted therapies or immunotherapy. Better biomarker testing could lead to more precise treatment selection, reducing the trial and error approach in cancer care. Exploring new treatment targets. Research is ongoing to discover novel molecular targets and immune checkpoints that can serve as new avenues for therapy. These discoveries could lead to the development of next-generation drugs that work more effectively against a wider variety of cancers. Personalized treatment strategies. Advances in genomic sequencing and artificial intelligence are making it possible to create highly customized cancer treatment plans. By analyzing a patient's unique genetic makeup and tumor characteristics, doctors can tailor therapies that offer the best chances of success while minimizing side effects. Conclusion. Both targeted therapy and immunotherapy have made significant strides in cancer treatment since 2022. While targeted therapy offers precision in attacking specific cancer-driving mutations, immunotherapy provides the potential for long-lasting responses by engaging the body's immune system. The choice between these approaches depends on various factors, including cancer type, genetic profile, and individual patient characteristics. As research continues, the integration of these therapies, along with the development of more personalized treatment strategies, holds promise for improving outcomes for cancer patients in the future. Thanks for watching our Global RPH production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you. Your support means the world to us. It helps us grow and keep delivering exciting, high-value content. Stay tuned, because the best is yet to come.